Welcome to another session of Datna's tutorial series. Today we will discuss about homeostasis. What is homeostasis? What comes to your mind when you hear homeostasis? Look at the image on the screen. What does it tell you? This shows an example of imbalance. What the body does is to ensure that there is a balance. Because the body is a complex entity, there are conditions or situations that can challenge the normalcy or the normal state of the body. The body has a way of ensuring balance. Our objectives for today are to define homeostasis, are to describe the homeostatic mechanisms, and to discuss the components of homeostatic mechanisms. The goal of the body is to ensure that the conditions within the body are in a state of equilibrium. What is homeostasis? How can we define homeostasis? Before we delve into the definition of homeostasis, let's try to understand the root words that form homeostasis. Homeostasis is derived from two Greek words which are homoios and stasis. Homoios means similar. It means like, when something or when things look alike, or same. Stasis, on the other hand, means stability. Stand still. To be constant. To be regular. And whenever we mention homeostasis, we are talking about the internal environment. That is, the focus of homeostasis is to ensure stability of the internal environment, is to ensure constancy of the internal environment. In other words, homeostasis ensures that the conditions in the internal environment are constant, are stable. And what is this internal environment? Internal environment is divided into two. We have the intracellular fluid and extracellular fluid. The intracellular fluid is the fluid within the cells. The extracellular fluid is the fluid outside. Is the fluid outside the cells. And this extracellular fluid can be divided into two. We have the plasma and the tissue fluid. Tissue fluid. The tissue fluid is also called interstitial fluid. So homeostasis ensures that there is a balance, there is an equilibrium between the intracellular and extracellular fluid. It ensures that the conditions within the internal environment is maintained in a state of equilibrium. So, homeostasis is defined as a process by which the conditions in the internal environment are maintained in a stable state, are maintained in a constant state, are maintained in a state of equilibrium. That is homeostasis, to ensure normalcy, to restore normalcy. That is the focus of homeostasis. How does the body do this? So this will take us to explain the homeostatic mechanisms. What are the homeostatic mechanisms? There are two types of homeostatic mechanisms. We have negative feedback mechanisms and we have positive feedback mechanisms. These are the two types of homeostatic mechanisms that operate within the body. Don't forget, in our last tutorial, when we were talking about the characteristics of life, we mentioned responsiveness as an important characteristic of life. Homeostasis is a way that the body responds to changes within the body. What are the components of homeostasis? What are the components that work to ensure that the body responds to changes within the body for both the negative feedback mechanisms and positive feedback mechanisms? The components are one receptor, 2 control center, 3 effector. These are the components of homeostasis. For easy comprehension, let's associate these concepts to what is happening or to what happens in the society. Let's say receptor is a spy. Receptor is a spy. They are detectors. They detect changes within the body. Control center, so let's say the receptor are people who spy or who look for information or who look for any change in the society. Control center is a decision maker. Decision maker. So our control center will be CEOs. CEOs. Let's say our control center is the CEOs. Now, the effectors. The effector is a messenger, or let's say the effector is a responder. Responder. That is, effector responds to changes in the body under the order of the control center. Let me give you a scenario for better understanding of these concepts. Receptors are people who are spies. They detect changes in the society. These receptors detect an offensive person in a mall who is trying to harm the people inside the mall. This offender is trying to harm people in the mall by making threats. The receptors, because they are spy, they quickly inform the CEOs of that mall. The CEO is the control center. So when the CEO receives the information from the spy, from the people who are spies, so the CEO now calls 911. He calls the police to come to respond to the situation. The police are the effectors. They respond to that scenario, to that situation. So we are going to use these examples to explain, to understand the negative feedback mechanisms and positive feedback mechanisms. 85% of activities in the body operate under the negative feedback mechanisms. Negative feedback mechanisms ensure that there is normalcy in the body. For instance, if something is too high in the body, there's a way in the body by which that substance can be regularized to be in a normal amount. And if a substance or a chemical is too low in the body, there's a way the body can make that substance to be a normal amount. So the objective is to ensure a state of balance, a state of normalcy, a state of orderliness. Like we said, that there are components of homeostatic mechanisms. We have the receptors. Like we said, receptors are spies. They detect changes in the body. They can be cells. They can be cells. They can be proteins. That is, the cells themselves can act as receptors. The proteins in the cell or the proteins in the cell membranes can also act as receptors. We have baroreceptors. Baroreceptors detect changes in the blood pressure. They detect changes in the blood pressure. Detect changes in the blood pressure. Baro means pressure. So baroreceptors are specialized cells or proteins that detect changes in the blood pressure. We also have thermoreceptors. Thermoreceptors detect changes in the body temperature. That is, if the temperature is too high or too low, the thermoreceptors will detect that change or those changes. We also have chemoreceptors. Chemoreceptors detect changes in chemical substance. They detect changes in the amount of chemical substances in the body. So these are some examples of receptors that we can find in the body. We have many of them. Baroreceptors for blood pressure, thermoreceptors for temperature, chemoreceptors for chemical substances. So they are detectors. So let's make a good example using thermoreceptors. Thermoreceptors, like I said, are the receptors that detect changes in the body temperature. Let's say that you have a patient who is experiencing fever or high body temperature because of weather, because of hot weather. The thermoreceptors, which are specialized receptors, will detect the changes or will detect the change in the body temperature of the body. And what will they do? They will send signals to the control center, which is the CEO, the boss. You know, the CEOs, the boss, they are decision makers. They don't have to do anything. Their job is to make decision. So these receptors, which are detectors, send signals about what they detect to the control center that, sir, the body is experiencing fever. The body is experiencing high body temperature. The body is experiencing high temperature. So when the information gets to the control center, which is the hypothalamus in the brain, hypothalamus in the brain, the hypothalamus initiates decisive action and says, okay, we need to ensure that the body temperature is brought to normal. We need to ensure that the body temperature is normal. So the hypothalamus, which is the control center, makes order and sends the information about the order to the effectors. Effectors are workers. They are what? They are workers. They are messengers. So the CEO orders workers to initiate response. So now the hypothalamus sends an impulse to the effectors. So the effectors can be the blood vessels. The effectors can be the muscles. The effector can be the skin. The skin. So how do these changes happen? The hypothalamus sends impulses to the effectors to respond to the changes, because the effectors are responders. They respond to changes in the body under the order of the control center, which is the hypothalamus in this case. The hypothalamus orders the blood vessels to dilate. Dilate means to increase in width, to increase in diameter. That is, the lumen of the blood vessels begin to increase in diameter so that more blood can flow. So the blood carries it. The blood carries it. Not only that, the hypothalamus will also instruct the skin to start producing sweat. The sweat glands will begin to produce sweat. The blood carries the heat to the surface of the skin. The sweat glands in the skin is producing sweat. So the heat now mixes with the sweat. And what happens after that? There will be evaporation. So, evaporation of sweat. The evaporation of sweat allows the heat to escape and makes the body to be cool. This is how the body responds to high temperature. So when the body is cool, the temperature begins to decline, begins to be normal. Which means that if we don't use external measures such as Tylenol or using Motrin to bring down the body temperature, the body itself has a way of regulating these changes. The nature has a way of regulating these changes. This is for high body temperature. Now, there is low body temperature. How does the body respond to that? The receptors will detect, the thermoreceptors again will detect that there is low temperature. The body is too cold, maybe due to cold weather. The receptors will now send the impulse because they have detected the change. They will now send the impulse, the signals, the message to the hypothalamus. The hypothalamus, which is the control center, the CEO, the boss, will now make a decision to raise the body temperature. By doing that, it will instruct the blood vessels to start constricting so that it can be reserved. Because when blood vessels constrict, it means that they narrow. And when they narrow, less blood will flow through it. Because blood carries heat, more heat will be reserved to make the body warm. Not only that, the hypothalamus will also instruct the muscles to start contracting. And the muscles will start contracting to generate heat. The hypothalamus will instruct the skin to stop producing sweat. That is, the sweat glands will be instructed to stop producing sweat so that there won't be loss of heat by evaporation. So the heat is conserved in that way. So when the heat is conserved in that way, it will increase the body temperature to a state that is normal for the body. The normal temperature in the body is between 36.2 to 37.2. So anything above this temperature may mean high body temperature. Anything below this may mean low body temperature. This is how the body regulates the internal environment. I will want you to think and explain in your words how the body regulates blood pressure using the baroreceptors as the detectors. So we have talked about the receptors, and we also talked about the control center, which is the second component of homeostasis. Like we said, that the control center acts as a decision maker. It instructs the effectors to respond to the changes in the body. And we have the effectors. The effectors, they are responders. They respond to the situations. They respond to control that situation, to bring that situation to normalcy. So effectors could be muscles, effectors could be skin, effectors could be anything that the body can use to respond to changes in the body. In summary, the negative feedback mechanism is where the response negates the stimulus. Like I said, the stimulus could be high body temperature, low body temperature, high blood pressure, low blood pressure. So the stimulus could be high, the stimulus could be low, but the role of an effector is to ensure negation. That is, if there is high body temperature, this is stimulus, or low body temperature, the effector is to ensure balance, is to negate the stimulus. So, negative feedback mechanism is a mechanism where the effectors negate the stimuli, where the effectors neutralize the stimuli. What is positive feedback mechanism? Positive feedback mechanism is where the stimulus amplifies the response. It is where the stimulus increases the response. It's where the stimulus intensifies the response. For instance, this is a stimulus, but the stimulus increases the response. This is the response. The stimulus amplifies the response. The stimulus intensifies the response, as opposed to negative feedback mechanism where the response negates or brings the situation to a balance. Look at the board. You can see this is a stimulus, and we have more effectors. And don't forget that the effectors are the one responding to the stimulus. Stimulus is an action, a challenge, and the body responds. So the effectors are the responders. The stimulus initiates more responses. The stimulus intensifies more responses. We still have the same components. We have the receptors, the control center, and the effectors. What will be our stimulus here? Let's say that a person sustained an injury to his finger, and this now results in the injury of the blood vessels that supply blood to this finger. Now there's bleeding. The person is bleeding here. So this is our stimulus. This is our stimulus. The receptors detect this stimulus, which is the damaged blood vessel and the bleeding. And what they do is that they send information to the control center. The control center, which is a decision maker, makes a decision to stop the bleeding. And it instructs the effectors to respond to the situation. In this case, the effectors are the platelets. The platelets migrate to the bleeding site. As they bind with the bleeding site, a chemical is released. Example of that chemical is chemotaxins. This chemotaxin attracts more platelets to migrate to the area of the bleeding. As more platelets migrate to the area of bleeding and bind to the bleeding site, this chemotaxin is released. that causes more platelets to go to the bleeding site. As more platelets go to the bleeding site, this chemical is released that also cause more platelets to bind to the area of bleeding. As the platelets bind to the area of bleeding, this chemical is released that attracts more platelets to go to the area of the bleeding to stop the bleeding. So this process will continue until the blood vessel is repaired, until the bleeding, stops. So this means that the stimulus causes more responses. The stimulus amplifies the response. There is one stimulus, look at the number of responses. The stimulus increases the responses. So the responses will stop when there's no stimulus present. The responses will stop when the stimulus is no more there. This is why positive feedback mechanism is a mechanism where the stimulus amplifies the response, where the stimulus amplifies the effectors, where the stimulus increases the response. You can see the illustration where the stimulus is increasing the effectors, which are the responders.